Hello, I'm Chris White, Eye Clinic Liaison Officer for MySight Nottinghamshire. I'd like to talk to you today about a condition that affects many people with a visual impairment, especially those with age-related macular degeneration. And that condition is Charles-Bonnet syndrome. Imagine waking up in the morning and walking into your kitchen where you expect to see just your normal kitchen. What you actually see is something quite different. I had a patient come to see me a few weeks ago who actually reported this to me. She'd come downstairs in the morning and looked into her kitchen, and she saw a small man trying to climb out of the sink and a ballerina dancing with a piglet. Really, really strange. This is what we call a Charles-Bonnet hallucination. What's actually going on is the brain is trying to overcompensate for the lack of information it's getting for your eyes, and in doing this it digs down somewhere deep in your memories and puts a picture in its place. It's very common in people with AMD, and it's also very common in other eye conditions as well. They're usually pleasant images. They can be quite strange. You can see people moving, blobs of colour. Others see little people, also known as Lilliput people. The thing that they all have in common is that they are silent. They're purely visual hallucinations, so they make no sound. Even though this is very common, very few people have heard of it. The thing to remember that this is to do with your vision. You're not going batty, it's not dementia, it's not a mental illness. But if you're in any kind of doubt whatsoever, speak to your GP or talk to your ophthalmologist. Some people find these hallucinations annoying. They can last for a few hours, a few days, or even a few months in some extreme cases. Thankfully, there are some organisations who help, and I've put a list of these at the end of this video. The Macular Society offer help with Charles-Bonnet syndrome, and there's an organisation called Esme's Umbrella who are there specifically to raise awareness of Charles-Bonnet syndrome and to help the people who need it. There are some tips and tricks that I can tell you for dealing with a Charles-Bonnet hallucination. The first one is this: change the lighting. If you're in a darkened room, put the light on. Or move into another room, or step outside for a little while, or close your eyes for a few seconds and then open them again. This is often, enough to stop the Charles-Bonnet hallucination from happening. The next is eye movement. Basically what you need to do is sit about a metre away from a wall, or stand a metre away from a wall, and make sort of 2 points in your mind about 2 metres apart, one on the left and one on the right. And what I want you to do is move your eyes from left to right, once every second for about a minute. This again can make the hallucination go away. But the most useful one I've found, the one that worked most with most people, is this. You need one of these, a torch. Basically what I want you to do is shine it upwards in front of your eyes. Not directly at your eyes, but just upwards in front of your eyes. It's thought what this does is stimulate the remaining cells that are working in the back of your eye. They then send a signal to the visual part of your brain, which is this big lump at the back here. And the brain, instead of putting a hallucination in place, actually switches it off. I hope this has been helpful. If you want to know more, here are the contact details I promised you earlier. Stay safe, stay indoors. The Macular Society, www.macularsociety.org. Telephone 0300 30 30 111. RNIB, www.rnib.org.uk. Telephone 0303 123 9999. Esme's Umbrella, www.charlesbonnetsyndrome.uk. Telephone number 0207 391 3299. This number is manned 24 hours a day, 365 days a year. And of course, my site Nottinghamshire, Seeing Beyond Sight Loss. www.mysightnots.org.uk. Telephone 0115 970 6806. We'll always be happy to talk to you.